For more on Denosa's 9th National Congress, I'm joined by Simon Hlungwani, who's Denosa's president. A very good afternoon to you, Simon. Thank you very much for your time coming in for praise from the president about the role you've played, especially during a very difficult time, COVID-19 pandemic, when the COVID-19 pandemic hit us. But at the same time, underscoring the point that we all look up to you, to your exercising your responsibility of administering quality health care to all.
Thank you, Vuyo. Indeed, the president also used the word nurses are the backbone of healthcare services in our country. And we think that is an acknowledgement from the president that without nurses in our country, we could not have contained and controlled COVID-19, and we could not have managed to immunize and vaccinate everyone from COVID-19. So that is appreciated because it is coming from the head of state and appears or sounds like he is the caring president of our country. Therefore, we appreciate that as the necessity has been heard by all our delegates, and it was open for everyone to hear. So we appreciate all that which has been said by the president. And furthermore, that appreciation, he has also made mention that they are committing to assisting health services by ensuring that there is improvement in the health infrastructure, which is going to go a great deal in ensuring that there's access to health care in many different areas, particularly the far-flung and rural areas in our country.
One would imagine those health infrastructure and other issues are among the critical issues that you are supposed to discuss at that conference. Let's start with the NHI, just your attitude and approach towards what has been said and done up until now.
Well, let me also put it to you that as Denosa, we have made submission in writing and as well as oral presentation to Parliament when the NHI was being discussed, because we believe that NHI, as endorsed by the World Health Organization, it's called universal health coverage, which means it gives access to every citizen in society who has money or who does not, and even those who do not have money, access to healthcare, irrespective of whether what did they have in their pocket. So when it comes to South Africa, we know that we've got many people who are poor and quite a few who can afford to pay for healthcare. When NHI comes in, it will then assist in ensuring that there is a balance between those who have and those who do not have to get access. In fact, it should be quality access of universal health coverage throughout the country. So from what it has been done in the country and what the president has said, including what the minister are doing, is that we believe for NHI to be realized in our country, they should be preparatory. The preparatory must also include health professional productions, and that's where majority should be nurses because these are the backbones of the health system. Nurses can be able to reach to the far-flung and the rural areas without having to depend on another health professional, so because they have an independent function in those areas. So we can do better, just as it has been done in the past, where we used to have Umama Albertina Sisulu riding in bicycles going to Deep Town to deliver babies in those shacks and all that. So the same model can be utilized in ensuring that there is enough health professionals, and in particular we're referring to nurses, but all the others, your pharmacists, your doctors, your emergency medical personnel can be huge. If we do, the country does a huge investment in that context. Therefore, access to primary health care will not be difficult for everybody because the World Health Organization as well says we must have access at a radius of 5 kilometers. So people would not have to walk long distances to clinics, but the health services can also get to them in the villages. Whether we can utilize what we would call private nurse practitioners who will be contracted to a particular area and reach out to communities. That is the modeling that we'll do. But the most critical part is investment in health in all aspects of health, including the health information systems, including the infrastructure, including the production and training of health professionals, and improvement of conditions of service in the public sector, but also in the private sector.
Okay.
Then unlock that people must not be spending when they have to get access to healthcare.
Do you feel that nurses are appreciated? And I'm asking this because in the context of the budget that we are now talking about, which is yet to be passed, among the criticisms is leveled at the government is that the public sector wage bill is too high. I know you hold a different position.
Well, I must indicate that what we have seen in the past, if we were to make a proper analysis insofar as the health sector is concerned, I can take you backward that when we started in our country with a disease burden that is rising, it meant that the few health professionals that we have must provide for a particular, and I will take you back to the time that our population was 46 million. Now we are talking about 63 million, which means there's an additional around 17 million of people within our own population that are to be taken care of when it comes to health service delivery. But the number of health professionals, when we look at it from the system, have not been growing. In particular, at the public sector level, the number of nurses that are employed in the public service has never been growing. So we do think that the problem is the understanding of the system by those who criticize it without making deep analysis. Because when you grow the population, when more diseases come, it adds a strain by adding a disease burden where you have a lot of chronic diseases, you have a lot of accidents, we have a lot of many other diseases that are coming that we know they need more hands to take care of. But there is no appreciation that the level and the number of health personnel is not commensurate to the demand that we have as a country. So we think it is misplaced that people can always talk about the wage bill. When it comes to the clinical people, if at all, the problem is the wage bill, we can drill down to checking how many were the public servants and in particular nurses or health personnel in 1999 or 1997. You'll find that the numbers actually have gone down from what it used to be. So if the wage bill is the one that has grown, it has to do with the financing of how the structures of financing has been handled. We do believe that it cannot be that we say the nurses are overpaid, because nurses in our country are underpaid, and we actually feel they should be paid even more. So in that context, we believe that it's an analogy which we do not agree with. We know that it has always been there, but I think it is only pushed by those who want to push for the cutting of public servants to be reduced to a level that they would deem it fit. However, the repercussion of that is that services are going to suffer, particularly for those who are poor, because they will not be able to access such services because we know they don't have money, and it can be dire. A lot of people can die if we do that. So we don't agree with that notion. However, we must talk about, if you look at the budget of health, for many years, budget of health has not been growing, has not been added. And it only started being added with the proposed budget that has been tabled now. However, we know it has not been approved as yet. For the next 3 years, it has been indicated it will move from around 277 billion to 333 billion. So it is for the first time that we will have growth in the number, in terms of the figure of the budget for health. So it can be that we say there is a problem there.
Simon Hlungwani, Denosa President, let me thank you very much for your time this afternoon. They are having their 9th National Congress, which is going to end on the 28th of March, looking at various issues affecting the nursing profession.